So some men considering testosterone replacement therapy are maybe a bit afraid of high doses, and they start with very low doses, maybe 50 milligrams a week. Explain to us, Gil, why that isn't a good idea.
This is the TRT and Hormone Optimization YouTube channel. And if you want to learn all about the science-based information on this topic, consider subscribing, hit that notification bell, and you'll be on your way.
Let me put this in layman's terms and give you a quick analogy so you understand. You're earning $500 a week in your job. You decide that your bills are $1,000 a week and you cannot survive at this level and you need to earn more money. Do you quit your job and then take a job for $400 a week? The answer is no. Why? Because you are not supplementing your current income with a second job. You're essentially replacing what you have with another job. So what you have essentially done is cut off your income and then replaced it with less income. So when you have low testosterone, don't think that the level of where you started is relevant whatsoever to your treatment. Your diagnosis on why you have low T is relevant. Your level is not relevant other than just to determine that you have a deficiency that needs to be addressed. Because if you started and your total T was 500, and I know we always talk about free T and all the other ancillary tests, but for the sake of making this simple, your free T is at 500 and you decide to get on TRT, it's not like you're going to have that 500 and get to keep it and then go ahead and top it off with another 5 and now you're at 1,000. Or if you start at 200, you need another 8. That's not how it works. The minute you introduce the exogenous hormone into your system, this negative feedback loop of the endocrine system, your HPTA, which is your hypothalamic pituitary testicular axis, recognizes the sufficient hormone levels or even insufficient hormone levels that are constant and steady, and it turns off the mechanism of your pituitary and hypothalamic response that requests that your body go to work and produce testosterone. So you're essentially going to zero or almost zero because your gonadotropins or tropic hormones, luteinizing hormone and follicle stimulating hormone are going to be shut off, and you're relying strictly on this exogenous hormone, testosterone, to go ahead and give you everything you need. So if you're supplementing or replacing your current levels with an insufficient level, all you're doing is going from low to zero back to low. You're not optimizing and you're not doing yourself any favors in doing so. You're just going from a naturally producing individual to a now dependent on medication individual who is still in a chronic state of deficiency. So yes, there are concerns of starting too strong, too aggressively, too high. You need to find the moderate dose with a competent provider who understands, based on your personality, your symptoms, your signs, your side effects, and your risk profile, and where you likely have been when you were younger, to get you to a level that is moderately optimized currently. Stop, analyze, assess, see how you feel. Then go back and reevaluate with your labs and your subjective assessment and see how things are going. And at that point, make a decision to come up, come down, tweak the frequency, add in other products, etc. But this is not something that you want to start at a level that is so conservative where you're just going to get frustrated, come back, kind of get into that negative mindset and lose the optimism you had going in of trying to feel better over time, because now you're 2, 3, 4 months in and you're still hitting a rock wall. And it's very hard to come out of that after you've had high hopes and you've read, things and watched the videos and joined the groups and you're seeing everyone's, raving about how great they feel. And now you've experienced a subpar result because you decided to be too conservative. Your provider decided to be too conservative. So that right there is another flawed attempt, no different than when guys start too high and then they have to chase away any sense of anxiety, insomnia, rage, side effects, etc. So too little, no good. Too much, no good. This is why this is more of a individual approach that requires a full, true 1-hour assessment and a conversation for someone with experience to actually determine, rather than just a cookie cutter conveyor belt stamp type, everyone gets the same dose, same medication, which we see quite often these days, which is quite sad. So, we have a link in the description and people are free to reach out if they want to either do informational only consultations or if they'd like to be referred over to the clinic for more of a medical approach. But either way, do not do it alone. Do not go with a provider who is the quote unquote least expensive or just happens to take insurance, because again, they're just going to put you on a cookie cutter or whatever Google tells them is the correct dose for that medication. Not the way to do this at all.
Okay, awesome. And now go watch one of these videos to learn a ton more about TRT and hormone optimization.